water while you're up?
Yeah, sure.
Thanks, Helga.
No problem. I don't know why, but I've been super thirsty lately.
OMG, that's a huge glass of water you got there.
I have to go to the bathroom.
Already? Didn't you just go like 15 minutes ago?
Yeah, but I've been super thirsty and hungry lately.
Helga, I think it's time you see the doctor.
Yeah, I know. I was planning on going tomorrow.
Hey, I'm Dr. Bieber. How you doing today there, eh?
Well, I've been better.
Like, the nurse says you've been experiencing this for a while now. Some weight loss, extreme hunger, extreme thirst, some blurred vision, and a lot of fatigue. When did this start?
I think about a month ago, maybe.
Alright, well, I want to run a few tests. We're going to start with the fasting plasma glucose test, but that's going to require you to not eat anything for 8 hours, and then we'll test your blood sugar. After that, we're going to give you 75 grams of glucose dissolved in water and test your blood sugar again after about 2 hours. This is called the oral glucose tolerance test. If both of those show heightened glucose levels, we're going to run a hemoglobin A1C test. If that result is 6.5% or higher, you have diabetes.
Wait, isn't there 2 types of diabetes?
Yes, there is. If we discover that you do in fact have diabetes, we'll run a test to see if there are antibodies in your blood against the cells called islets of Langerhans. Those are the cells in the pancreas that produce insulin. If the antibodies are present, you have type 1 diabetes, which is an autoimmune disease in which the body attacks the cells of the pancreas. If those aren't present, you have type 2 diabetes. Any questions?
No.
Alrighty, well, we'll get those tests running. 3 days later.
Hey, Dr. Bieber. This is my friend Bob from Brazil.
Hey, Bob from Brazil.
Hi.
So, Helga, we got your test results back. It looks like you do have type 1 diabetes. Thankfully, though, we caught it early enough that it should be fairly easy to get under control. If we hadn't, your blood sugars would have started fluctuating out of control and causing some serious damage to your body and some life-threatening issues. One of those life-threatening issues is ketoacidosis.
What's ketoacidosis?
It's where the pH in your body becomes more acidic because the body is using fat instead of sugar as energy. That could have put you in a coma or even killed you.
So, is it infectious? Like, can I get it from her?
No, it isn't infectious at all, so don't worry about getting it from her.
Wait, so how'd I get it?
Well, it may be hereditary, so you could have gotten it from your parents, but it could also be caused by a viral infection you had as a kid. The body overreacts and attacks the islet cells we talked about the other day because it can't tell the difference between those and the cells from the viral infection. But it could also be completely random. We're not really sure. So each case is kind of different.
So, like, what's it doing to my body?
Well, here's the thing. When you have type 1 diabetes, your body attacks insulin-producing cells, so your body doesn't get the insulin it needs. Insulin removes sugar from your blood to use as energy. Your body doesn't do that. Because they can't use sugar as energy, other parts of your body can start to fail if we don't control your sugar. Things like your eyes, heart, kidney, and liver can become glucose deprived and stop working.
Are there any new treatments or anything? What can we do?
Well, I was just reading in a medical journal that there are some transplants of islet cells and entire pancreases available, but those are generally reserved for someone with serious complications or intractable hypoglycemia, which is when the blood sugar levels in your body are uncontrollably low, which could also put you in a coma. Helga doesn't have either of those things, so I think the best course of action is just to get her blood sugars under control and teach Helga how to live her life with type 1 diabetes. 1 week later.
OMG, what is that?
Didn't you know Helga has diabetes? She has to do this every time she eats now.
Ew, what is diabetes?
My islet cells don't work, so I have to stick myself with this needle thing and inject myself with insulin to control my sugar. The doctor said that once we get more under control, I can get this pump type thing that pumps insulin in automatically and keeps my sugars how they're supposed to be.
So is insulin like this new drug or something?
No, and there aren't any real side effects either, so yeah.
So wait, are you gonna get better? Or does this mean we can't go to Starbucks anymore?
No, we can still go to Starbucks. I won't ever truly recover though, because it'll always be there and I'll always have to watch my insulin, especially when I go to the gym or I skip a meal.
Well, that stinks.
Did you guys know that 1.25 million Americans, children and adults, have type 1 diabetes?
Wow, that's a lot.
I didn't realize that it affected so many people.
Yeah, I know. And recent studies show that there are more type 1 diabetes cases in colder climates, like Wisconsin, due to an increased risk of viral infections.
Should we get tested?
No. Just because we live here doesn't mean we're gonna get it. It's a genetic disorder, isn't it?
Yeah, actually, scientists have identified nearly 50 genes that are linked to type 1 diabetes.
50 genes? If they're using genetics now to identify diabetes, how did they use it to test it if you had it?
Well, the oldest method for testing diabetes was to taste the patient's urine. And if it was sweet, then diabetes was likely.
You couldn't pay me enough to do that.
Me either.
Remember, diabetes is serious, so it is important to know about this if your friends or family were to ever be diagnosed. Know the warning signs, know the symptoms, because it affects many and you want those close to you to be prepared.
So,
I have it recording.
nurse says you've been.
What?
The fasting plasma glucose test.
Okay.
But that's going to require you to not eat anything for 8 hours.
I can't, just stop it.
In which the body attacks the cells of the pancreas. And type 2 is different.
Okay. Is every time she eats now.
I forgot my life. Are you gonna get better? Or are we done with Starbucks for ever? Insulin like this new drug or something? I don't know why I looked at my
It's
Is insulin like this new drug or something? I like that hand again. I don't know why I did that. Insulin like this new drug or something? I can't. Wait, so are you gonna stop? Taylor, what are you doing? I can't. Just cut it. Just cut it.
This is from the beginning.
Whenever you're ready.
So, how good we got your test result?
I didn't do anything.
I know. That one was me. I'm sorry.
Restart. Just go for it.
Are you just
Yep,
still
just keep
recording?
going. Just go.
Okay.
I'm sorry.
Right, no, sorry.
That was
Just-
Dana's
I know,
fault.
that was my
me.
fault.
Just wait for the beep.
Yeah.
And then go.
Well, you can just go whenever you want.
Yeah, actually, scientists have identified nearly 50 genes that are linked to type 1 diabetes.
Good.